Welcome back, viewers of 8 Television. My name is Dr. Mpunguziwe Kenneth from Mass Medical Specialist in Mbarara, opposite Lakeview Hotel. I'm here again at 80 Television to bring back a smile on those who have already given up on their medical conditions. We have always advised, especially the youth who usually watch us at the 80 Television, and the elderly and other people, so that we give them knowledge about medical conditions, so that you don't die there when you think that your condition cannot be treated. These are very treatable conditions, and those which can be palliative, which don't have medication or which don't have treatment, we also bring them here. As last time we discussed about other medical conditions, but this time we have brought a very important condition that is affecting youth, commonly, and that is hernia. Hernia is a medical, it is a surgical condition that is affecting people worldwide, and it is common in male than in females. Hernia, it is as it is a surgical condition, by definition, hernia, we have protrusion of an organ or a tissue through the defect. So when you have a weak muscle, or when you have a defect, let it be a canal, and there is a protrusion of organs through it, it is called hernia. That is herniation of the organs. And it's very common. People are complaining of hernia. Here at Mass Medical Specialist in Mbarara, we see very many, especially youth, because the predisposing factors, as we are going to see, are also affecting a lot of youth. Then the elderly, because of their aging of the muscles. So we wanted to see types of hernia. We wanted to categorize them for you to understand. We have different types of hernia, but the most common are the hernias of the abdomen, where we have groin hernias, that is femoral for females, and then inguinal for males, of which those ones can also be divided into reducing and non-reducing. Non-reducing are those, reducing are the ones which you can push back into the sac, and then reducing are the ones which you cannot push back. Non-reducing are the ones which you cannot push back. Then they can also be incarcerated, where you push it back and it fails to go, and then strangulated, where it doesn't go, and it rotates on its stalk, and it can cause strangulation, ischemia, and then it dies. The tissue can die. If it is an intestine, it rots, and if it is any other tissue like in sliding hernia, if the blood has entered into the sac, you can also have strangulation, or the bladder can get rotten, or it dies, ischemia. So hernia is a very common thing, and we need to know about hernia. So after leaving those, some of other abdominal hernias, examples, we have Spigerian hernia, which gets into the flank of the abdomen. Then we have those ones that go into the posterior, the lumbar hernias, and then obturator hernias, which are occult inside there. And then we also have hiatus hernia, where there is protrusion of the stomach into the chest, above the diaphragm, and that one is very well commonly confused with the ulcers or cancer in adults. They think because of the pain in the chest, they think they are developing cancer, which is very important to do investigations and understand early in the time. If it is just a hernia, it can be corrected, because we have the best surgeons all over Uganda who can correct every type of hernia, and hernia is not a very complicated disease that surgeons have to refer to India, and it is very well treated in Uganda. Even us here at Mass Medical Specialist in Mbarara, we can easily correct most of the hernias. We also have this type of hernia called umbilical hernias, commonly in children, especially which comes as a result of a defect in the umbilicus. If the umbilicus knot is well noted well after birth, children tend to get those type of hernias. We also have other types of hernias that are common in people who have gone under operations. They are called incisional hernia, and they usually come as a result of usage of bad sutures, or sometimes they happen because of infection. From there we go to what causes hernia. No, before causes of hernia. Yes, causes of hernia. What causes hernia? Hernia is mostly increased pressure into the abdomen. When there is increased pressure, especially caused by masses into the abdomen, eating hard stuff, that causes constipation, especially in youth at university, and those ones in town places, they usually eat a lot of chikomando or chapats, and then they don't drink enough. And so other causes of hernia, after that of elderly aging of the muscles, then increased the abdominal pressure. Then we have seen congenital. We also have congenital causes where somebody is born with defects, especially big femoral canal, or direct hernias which go through the canals, and then spermatic cord, and then the canals, and therefore you can easily get a defect, or a defect diseases of the muscles. Muscles are also having sometimes diseases that can weaken them, especially those which are nutrient related. Like for example, in people with malnutrition, people with lack of some muscles in the body, they can easily get different types of hernia. And then trauma can also predispose you to hernia. Then people who are smokers can easily get, is a risk factor. Somebody can easily get hernia. So youth who are smoking, eat television is advising you to really avoid smoking, and then eat healthy foods, and then you can easily have a very healthy and good life. After causes, we can now see the signs and symptoms. How do you know that you have a hernia? Hernia, you can know when you get hernia. You can easily know because most of the hernias, especially those which are external, you can easily see a mass, protrusion of a mass. You have not been having an inguinal mass, you see something bulging in the abdomen, on the umbilicus, anything that is bulging, think about a hernia. A mass, then it can be painful. If it is strangulated, it can go on to cause you vomiting, it can cause you fever, it can cause you general body weakness. You can even get confusion. At the end of the day, if it bursts, you can even get peritonitis, especially if it is not interrupted early enough. If the doctors don't intervene and you stay for long without being worked on with a hernia which is strangulated, it is very dangerous. And then we can see, after knowing the signs and symptoms, and major one being swelling or bulging of any mass, we can now see we have seen the risk factors, including smoking, heavy lifting, and then age related, and then people with chronic diseases like TB. Because of coughing for long, you are increasing intra-abdominal pressure. Then masses, any masses in the abdomen can predispose you to those hernias. And then the management of investigation of hernias is majorly radiology, where we do ultrasound scan, and we can easily identify which type of hernia we are having, and then we can go on to do, like hiatal hernia, it's better done using a CT scan, where you can see the herniation of the stomach through the hernia, through the cardiac opening, and then you can know which type of hernia using those methods. But there are other methods we can do apart from radiology. A person who has a hernia, if it is confirmed, you can easily do supportive investigations like a complete blood count. You can do electrolytes for those who are very sick and they are suspected to be having a gangrene gut or the content in the sac. Then you can also do blood grouping and cross-matching to prepare these patients who need blood. Then you can also do RBS for blood glucose, so that you know the state and then RCT HIV status. You can also do them to support your management during surgery. Then management is entirely surgical unless otherwise, for cases for those pregnant mothers who can wait for surgery to be done after they have produced, for those elderly who no longer need to be done a surgery, very old, but if it is strangulated, you have to try, respective of the age. Then for young people less than 5 years with umbilical hernias, you can wait until 5 years. When it doesn't resolve itself, you can now do a herniotomy on them or herniorrhaphy on adults. And then management is entirely surgical for eradication, and then maybe recurrences. If we have recurrences, we can still do surgical and put mesh and avoid recurrences. Then prevention is the most important thing. Prevention is better than cure. You can easily prevent this by doing the following. If you are a youth, you have chronic constipation, prevent it. Avoid eating hard food, hard corns, and drink a lot of water. Make sure that you eat soft things like yellows, like greens, enough water, and then soft foods. And then if you have any chronic conditions like TB, you can easily get treatment, and TBs are there to avoid increased intra-abdominal pressure. Then if you have a mass inside like fibroids and they are causing you hernias, you can easily go for surgery. They remove those fibroids. And then if you haven't gotten any hernia or a predisposing factor like smoking, avoid smoking, especially the use watching a television. Those are some of the things. If you have any issue to ask, you can always contact us at the Mars Medical Specialist in Mbarara, opposite Lakeview. We are always there for you, for youth, for everyone. You can always come to Mbarara. If you are very far, a television advises you to go to the nearest medical area or medical center or in a dwalilo that is around, so that you can get services from there. But avoid those who are lying to you that herbs and other things can prevent hernia. Thank you so much. I remain Dr. Mpumuzibe Kenneth, and I'm so happy and appreciate for you for viewing us all this time, and appreciate 80 television management for visiting us and loving us as Mars Medical Specialists. Thank you. We link up next time. Thank you so much.
You're watching a Youth TV, empowering you.